Hello, dear ones. This is Dr. Olivia Thompson, and today I'm going to share information with you that could completely change your perspective on some common medications. Have you ever wondered if what should be protecting your health might be silently destroying your memory? That's exactly what we're going to discuss today. Imagine the following situation. You or someone you love over 60 years old has begun experiencing frequent forgetfulness, difficulty remembering names, or finding words during conversations. Many attribute this to the natural aging process, but what if I told you that in many cases the cause might be in your medicine cabinet? Medications that millions of elderly people take daily, with a doctor's prescription and considered safe, could be tripling your risk of developing dementia in the coming years. If you're over 60 or caring for someone in this age group, and you're noticing these warning signs, pay very close attention to what I'm about to reveal today. This information could not only explain these worrying symptoms, but also offer a way out, a path to regain the mental clarity that seemed lost. As a doctor specializing in holistic health and natural medicine, I've seen impressive cases of cognitive recovery in my practice after simple medication adjustments. And I want to share this knowledge with you today because I believe everyone deserves to know what might be happening to their brain or to the brains of their loved ones. The problem occurs because certain medications, many of them extremely common and used by millions of people, block or significantly reduce the production of acetylcholine, a neurotransmitter essential for memory and cognition. When these levels drop, the connections between neurons weaken, creating a mental fog that, with continued use of these medications, can evolve into cognitive deficits that seem permanent. It's as if the brain were slowly being disconnected, neuron by neuron. Can you imagine the impact this has on a person's quality of life? Progressively losing the ability to remember precious moments, family members' names, or even how to perform simple daily tasks. This reality has become increasingly common, and the saddest part is that it could often be avoided with proper information. Let me share a real case I recently treated. I met Mrs. Helen, a 72-year-old woman who came to the office accompanied by her daughter. "Doctor, my mother wasn't like this," she reported with tearful eyes. "She was always active, solved crossword puzzles, managed the household bills. In the last 2 years, she started repeating the same stories, forgetting appointments, and becoming confused with simple tasks. We thought it was Alzheimer's beginning." When analyzing her medication list, I immediately identified the problem. She had been taking 2 medications with potent anticholinergic effects for over 3 years. And this is a pattern I see repeatedly in my clinical practice. Let's look at the culprits that need to be known. Pay close attention because you or someone close to you might be using one of them right now. First, we have anticholinergics for overactive bladder. Medications like oxybutynin and tolterodine, commonly prescribed to control urinary incontinence, especially in women over 60, are the main suspects. Did you know that a University of Washington study showed a 54% increase in dementia risk after 3 years of continuous use of these medications? This is an alarming fact that is rarely mentioned at the time of prescription. Second are first-generation antihistamines. Substances like diphenhydramine and hydroxyzine, found in popular allergy and insomnia medications such as Dramamine and Benadryl, easily cross the blood-brain barrier and block cholinergic receptors in the brain. Many people use these medications on their own without imagining the impact they can have on cognition, especially when used frequently. The third group includes certain tricyclic antidepressants such as amitriptyline and imipramine, often prescribed not only for depression but also for neuropathic pain in the elderly. These substances have potent anticholinergic effects, which become especially harmful when used chronically. Recent research shows that elderly people who use these medications for more than 2 years have an increased risk of developing cognitive problems. Last but not least, we have muscle relaxants such as cyclobenzaprine and orphanadrine, commonly prescribed for back pain and muscle tension. Did you know that these medications have significant anticholinergic effects and have been associated with cognitive decline in recent studies published in the Journal of the American Medical Association and the British Medical Journal? And many people take these medications for long periods without any monitoring of cognitive side effects. Sounds alarming, doesn't it? You might be wondering if you yourself or a loved one is exposed to this risk right now. But here's the good news I want to share with you. In most cases, the effects are reversible when the medication is discontinued or adequately replaced. That's right. The brain has an incredible capacity for recovery when the offending agents are removed. Isn't it wonderful to know that, in many cases, what seemed to be the beginning of dementia can be reversed? Returning to Mrs. Helen's case that I mentioned, we worked with her urologist to replace the oxybutynin with a more modern medication with less anticholinergic effect. We also switched her antidepressant to one with a safer profile for the elderly. Additionally, we advised behavioral techniques to complement the treatment of urinary incontinence and mood. The results were surprising. In just 2 months, her daughter reported emotionally, "It's as if my mother were coming back." She remembers her grandchildren's names again, has resumed reading, and has even gone back to managing her own budget. Cases like this motivate me to share this knowledge with as many people as possible. Can you imagine what it means for a family to recover their loved one who seemed to be getting lost in the mists of forgetfulness? Now, let's talk about what you can do today to protect your cognitive health or help someone you love. These tips are precious and can make all the difference. First, review all your medications. Make a complete list of everything you or your family member takes, including over-the-counter medications, those that seem harmless and that we freely buy at pharmacies, and also supplements. Often, the most harmful anticholinergic effects come precisely from those remedies we consider harmless, such as those for sleeping or allergy. Second, consult your doctor. Never, ever discontinue medications on your own. It can be dangerous. Take the complete list to your doctor and ask for a specific evaluation of the anticholinergic potential of these substances. Ask about safer alternatives for the brain. A good professional will value your concern and work with you to find the optimal balance between treating existing conditions and protecting your cognition. Third, consider therapeutic alternatives. For each condition, there are more modern and safer options for the brain. For example, behavioral therapy can be very effective for an overactive bladder. Melatonin can help with insomnia problems without the side effects of conventional medications. And there are non-sedating antihistamines for allergies that don't cross the blood-brain barrier. Have you explored these alternatives? Talking to specialists in integrative medicine can open doors to treatments you didn't even know existed. And finally, actively strengthen your brain. Adopt a diet rich in antioxidants, such as berries, dark green leafy vegetables, and fish rich in omega-3. Exercise regularly, even if it's just light 20-minute daily walks. Maintain activities that stimulate cognition, such as strategy games, reading, learning new skills or languages. Your brain is like a muscle that needs to be constantly exercised. Did you know that based on the latest studies published in JAMA Neurology and the British Journal of Clinical Pharmacology, reducing exposure to anticholinergic medications can decrease the risk of developing dementia in susceptible elderly people by up to 65%. The difference between knowing this information and ignoring it can mean years of cognitive independence, quality of life, preserved memories with those we love. Think for a moment. Memory is our most precious asset. It's what connects us with those we love, with our past experiences, with our own identity. When we lose memory, we lose part of who we are. And often, protecting it can be as simple as switching one medication for a safer one, or complementing conventional treatments with natural and behavioral approaches. Have you ever stopped to think how many people in your family or circle of friends could benefit from this information? Perhaps your father, who has been taking prostate medications for years, or your aunt who constantly uses allergy medication. The knowledge I've shared today can make a significant difference in these people's lives. I want you to know that we are not defenseless in this scenario. With adequate information and a sincere partnership with conscious healthcare professionals, we can protect our brain and our cognition even when we need to treat other health conditions. It is possible to balance the treatment of physical symptoms with the preservation of our mental faculty. Before we conclude, I have a special request. If you know someone who is facing memory problems, especially if that person is over 60 and regularly uses medications, share this video. This information can literally change the course of that person's life. It may be the first step to regain the mental clarity that seemed lost forever. Remember, your mind deserves protection, and often the solution may be closer than we imagine. In the next video, I'll reveal how certain food combinations can enhance brain recovery after exposure to these medications. So be sure to subscribe to the channel and enable notifications to continue receiving information that can transform your health and quality of life. If this content was useful to you, leave your like, share it with those who need this information, and tell us in the comments if you or someone close has had experience with the medications we mentioned today. Your story can help other people recognize important signs. Thank you for dedicating your time to this video. This is Dr. Olivia Thompson, committed to your holistic health and well-being, and I'll see you in the next video.